Welcome to the Sleep is a Skill podcast. My name is Molly McLaughlin, and I own a company that optimizes sleep through technology, accountability, and behavioral change. Each week, I'll be interviewing world-class experts ranging from doctors, innovators, and thought leaders to give actionable tips and strategies that you can implement to become a more skillful sleeper. Let's jump into your dose of practical sleep training. Welcome to the Sleep is a Skill podcast. Today's guest is going to help us shed some light on some really interesting topics around sleep that you might not have considered. She's actually carved out a name for herself on Instagram as Dr. Fit and Fabulous because she is a practicing board-certified OB-GYN. However, she's also really helped educate some of her followers and growing followers around the topic of understanding keto, glucose as it relates to our health, but also our sleep and preventative medicine along with fitness. So we're going to hear a little bit more about her, but some really fascinating link-ups for many of us that might not have, kind of done the work to understand just how much of a role our hormones and our glucose regulation can have on our sleep and then what to do about it. So a little bit about Dr. Jamie. Dr. Jamie Seeman is a board-certified OB-GYN practicing in Omaha, Nebraska. Born and raised in the state, she played collegiate softball for the Cornhuskers. She has a Bachelor of Science degree in nutrition, exercise, and health sciences. She then went on to graduate medical school and completed her OB-GYN residency at the University of Nebraska Medical Center. She currently is in private practice at Mid-City OB-GYN, offering a full range of services, gynecology, robotic surgery, and primary care. She is a fellow in integrative medicine at the University of Arizona School of Medicine. She is a board-certified ketogenic nutrition specialist through the American Nutrition Association. She has a passion for fitness, preventative medicine, and ketogenic therapy, not only in her medical practice, but in her own life. She is married to her husband, Ben, a police sergeant, and has 3 young daughters. So let's get into more of the details of what she can help underscore for us around how some of the regular behaviors that we partake in and foods that we eat and stress management, how all those roles play a factor in getting great sleep. Welcome to the Sleep is a Skill podcast. My guest today is Dr. Jamie of Fit and Fabulous. And Dr. Jamie, I'd love to dive in with you and hear a bit more about your story as to how you came to create this whole business for yourself and become such a leader in this area.
Hi. Well, thanks for having me. I'm super honored to be here, and thanks for everybody that's listening. So I am actually a private practice obstetrician and gynecologist, and I practice in Omaha, Nebraska. But I also have a background in nutrition and exercise science, and I'm currently completing a fellowship in integrative medicine. So I have a little bit of a different background than a lot of my colleagues do coming into the medical space. I have a very preventative-based approach to my practice, which is unique in the OB-GYN world, but my practice is heavily based in nutrition and movement and some of these other integrative therapies. It's kind of funny how I ever really got into this, space. I had always thought I was probably going to go into medicine, but I came in here on a very personal level. I always say I'm just as human as my patients. And I had some health concerns a number of years ago and was diagnosed with prediabetes and hypothyroidism, and I just didn't feel great. And I had a major kind of life-altering experience losing one of my best friends. And it was just kind of one of those pivotal moments in your life where you really kind of start to look at your purpose and your passion. And I decided that I had to get my nutrition right, and I had to start taking better care of myself because I can't expect my patients to do anything that I wouldn't be willing to do myself. And because of my history of problems with glucose intolerance, I eventually settled on a low-carb ketogenic way of living back in 2015, 2016. And I've never looked back. My health is the best it's ever been. I feel amazing. And just last year, I became a board-certified ketogenic nutrition specialist. And it's just another great tool in my toolbox that I use with patients and clients and has really been life altering for a lot of people.
Wow, what an amazing transformation. I didn't realize all that background, which is incredible. And, I'd imagine just it took so much trial and error and things to really get yourself on that track. So I'm so excited to dive in more for, so many listeners that do come to Sleep as a Skill are really trying to get up under their health and understand how to impact their psychology or their physiology in order to impact their sleep. And it sounds like you're living proof and testament to what's possible. So I think it could be really great to, one, even just, I know you mentioned your glucose intolerance. And we do get a lot of questions around how that itself can play into this conversation around sleep and sleep quality. So I'm wondering if you could share any of your insights that you've come across as you've, kind of been able to test and see all the things that impact our glucose tolerance. I think so many of us are really getting cognizant to all the power that we have around, kind of stabilizing that a bit more. What are some of the insights you've come across as it relates to glucose and sleep?
Yeah, it's been interesting through my journey. About a year ago, I added kind of another thing to my regimen, which was starting to wear a continuous glucose monitor. And I wish I would have worn it way back when I was, super insulin resistant. It probably would have been really mind boggling
Right?
back then. But
Oh,
it's so cool to have data on our bodies. And
yes.
we're seeing this now with rings and bracelets and all these things that you can wear and watch and track your sleep data and your heart rate variability and your glucose numbers. And one thing I've really noticed, and glucose and glycemic variability is a huge problem in America.
Yeah.
About 80% of America has abnormal metabolic markers, one of those being, abnormal fasting glucose numbers. But what's interesting is that even people who have normal hemoglobin A1Cs, which is basically like a 3-month average of your blood sugars, a lot of them can still have these early changes in glycemic variability and hyperinsulinemia that can still cause a lot of health problems. And they can be very subtle. It can be fatigue, it can be problems with sleep, it can be hormonal imbalances, trouble losing weight. I mean, some of these things can be super subtle and not, super overt until it becomes, until it worsens and worsens and worsens. So one thing I've really noticed wearing my glucose monitor is the more stable my blood sugars are, meaning the less they're bouncing up and down, I feel better. I really started to notice when I would have these big ups or big downs that your body starts secreting all these counter-regulatory hormones, and they cause some interesting symptoms. For instance, when my blood sugar would spike super high and then start dropping, I would almost start to feel anxious. I might get a headache or feel like my heart's racing, almost like symptoms of anxiety.
Yeah.
And one of the really interesting things is, as I've started to put them on more patients, I've noticed that what some patients describe as generalized anxiety is actually really bad glycemic variability. So I think it's really interesting data to watch, and you really need a continuous glucose monitor and not one where you poke your finger, because that's just kind of a snapshot in time and you don't get to watch it. But the other interesting part is with sleep is watching what the blood sugars do while you're sleeping. For instance, when I first got it, I thought, well, I'm going to test out lots of different foods.
Right.
And like even ones that I wouldn't normally eat, just to see how they do. And I had pizza one night and I went to bed a couple hours later. And even as I was sleeping, my glucose was like going up and then down and then up and then down. And it took multiple hours for my blood sugar to stabilize. Now compare that to something like a heavy protein rich meal that's lower in carbohydrates, and I may not even get a bump at all. And my blood sugar is basically back to baseline, within 30 to 60 minutes. So it's very interesting, even looking at like mixed meals, with varying amounts of carbohydrates and what happens even over the next, few hours after you eat. And so that's been one thing, that I've really, really noticed. The other is that when I'm eating a consistent diet, watching the blood sugars overnight in relation to cortisol. We know that when we go to bed at night, our cortisol should be the lowest. And then it should basically peak 30 to 60 minutes after we wake up in the morning. And I've noticed that it will slowly go down throughout the nighttime. And then if you look at the time, as soon as my alarm clock goes up and my feet hit the floor, I start to get that cortisol peak, because I'll get a little peak in glucose just from putting my feet on the floor and getting ready for the day. So it's been super interesting to look at that. And when I put the data out there, a lot of people will say like, oh my gosh, is that normal? And I'm like, yeah, because it will spike during exercise too, right? So your body doesn't know if you're trying to outrun a bear or if you're exercising at the gym. And so we have these amazing processes inside our body, and it's really cool to like watch your body work, basically.
Wow, so interesting. And I know so many more people that are into this biohacking conversation, and wearables have really, their interest has been piqued around this glucose conversation. Do you have any suggestions for people that are curious about getting these glucose monitors, or any access or availability for people to be able to have access to that more regularly for a mass audience?
Yeah, I think that, well, you can always talk to your doctor, but I know sometimes without a diagnosis of diabetes, people have trouble, possibly with insurance coverage. And sometimes there are cash pay options, even if you can get a prescription. The sensor that I like that seems to be the cheapest is the Abbott Freestyle. And it's a sensor that's good for 14 days. And I think if every American even just wore a CGM for 14 days, the amount that they would learn about themselves would just be priceless. Now, there are some companies that have come to market that are directly selling to people who don't have conditions like diabetes. Like you have to be healthy, you can't be pregnant, you can't have diabetes. And there is a company I work with called NutriSense that's great, that you can sign up for, and you actually get to work with a nutritionist. So they actually monitor your blood sugars that first month and give you feedback on your diet, which I think is super cool.
Wow.
And then one of the largest online telemedicine people right now is something called Virta Health. And they really are treating diabetics, but they're using continuous glucose monitors too, but doing it through, you basically, have a doctor through your computer. You don't even go in to see them in person. So we're starting to see them used more and more and more. And the average consumer can get access to them. Like I said, there's these companies coming to market, and we could put it in the show notes too.
Yes,
I've got
please.
some discount codes that people could use to get these, because they're hard to find, but it's super valuable information.
Oh, 100%. And one of the things that we're really big on at Sleep is a Skill, given even the title, is this conversation that the area specifically of sleep is a skill set. And so that there's so much that we can do behaviorally to impact the results that we get each night. And in alignment with that, I think that things like this are so powerful, because when you start to see, oh my goodness, if I add a walk or this type of exercise onto, in addition, when I eat at a certain time, the changes that can make, I mean, it just can be mind blowing to consider, adding some apple cider vinegar along with certain meals and removing certain meals, all of these things. I mean, I know these sound so basic because you've been doing this for so long, but for so many people, this is like life altering.
Yeah.
Really
I think
cool.
Sometimes it's hard to make those connections. I always talk about, like in my clinic, the 5 pillars for me are nutrition, movement, sleep, stress, and environment, but they're all related. Like they all talk to each other. And what's been interesting for me, I would never say I had a sleep problem before, probably because I was in medical training and like working. I was like a walking zombie, right? So, but it doesn't mean I was getting quality sleep and the beeper and the cell phone and thing are like ringing all night long. So that's a whole nother issue. But since I've been low carb and ketogenic, I do find that I need less sleep, which is interesting because we do see that in some of the studies on the ketogenic diet. There's not a huge amount of studies, but there definitely are some, and they show improvements in sleeping patterns. Some of it, the studies are done on obese patients, so weight loss can be helpful in getting more restful sleep, obviously, because the larger you are, we see increasing rates of sleep apnea. And then of course, just the inflammatory nature of carrying extra body fat.
Yes.
And then we do see an increase in REM sleep and an increase in sleep quality. And most of that data came from children with epilepsy, that they were, able to really monitor their diets closely and monitor their sleep cycles. Part of the physiology of it is that it increases adenosine in the brain, and it helps reduce pain and inflammation that way too, which helps improve sleep. So there's probably lots of different pathways, that are helping, but I definitely have felt more rested. I used to fall asleep on the couch at like 8 p.m. just because of like horrible fatigue.
Yes.
And now I get to go to bed on my own accord. I get
It's
to go in, I get
amazing.
to do my routine instead of just like passing out. And
Yes.
I wake up at 5 a.m. to work out. So I, have an early rising in the morning, and I feel great. I feel ready for the day. That's been kind of the one big thing, is like I changed my diet, but it
Yeah.
changed all these other areas of my life too.
Wow. And let's dive into that a bit more, because we'll have people coming that are either testing out things like keto or even occasionally carnivore diets. And one, they'll have concerns around, the beginning period of how that's impacting their sleep, wanting to know if that will improve. And then two, concerns that their total sleep duration is less, which you kind of touched on, but they feel amazing. So it's kind of this trade-off for them of, how to progress, what to do about that. What have you seen, or how do you help advise people with their sleep as they maybe are shifting over into a keto or carnivore diet?
Yeah. So it's a slow transition, right? It's nothing that happens overnight. And the interesting thing about going low carbon ketogenic is basically what you're doing is you're teaching your body how to use these two different fuel sources. You're teaching your body how to burn fat at baseline and how to just use glucose for things like exercise and quick burst type movements and things like that. So you're literally laying down kind of these new protein transporters and in the mitochondrial membranes and transporters that put glucose and ketone bodies inside of the mitochondria. So it's a slow adaptation process. So we have to be patient because there's lots of adaptations occur, and they don't occur in a day. They don't occur in a week. They occur over months. And so, and then of course, as we affect one thing, something else might be affected. So you're always trying to kind of, find that, what I call like balance and harmony inside the body. And it's hard because we focus on one area and then we're like, oh, we gotta, do something over here. And I always say, be your own expert, because what works for one patient sometimes doesn't work for the next. So we really look at it on an individualized basis, because we're all built from different genetics and different DNA. So sometimes even there's, genetic susceptibilities or alterations that can change how we respond to these certain things too.
So interesting. And how does this all relate? So, you have so many areas of expertise to pull from. And of course, with your relationship to women specific and, as an OBGYN, what have you seen in the conversation of how women need to be more mindful, or, checking, should women be more mindful of, or look out for certain things or adjust certain things when looking to both get great sleep and kind of transition over to a keto lifestyle? What are some of the things that you suggest for them?
Yeah. So a couple things. First, in general, for women, when they're switching to more of a low carb lifestyle, when I think of like the three macronutrients, which are carbohydrates, protein, and fat, women are chronically across the studies eating a lot less protein. So one thing women can do is boost their protein, because when you drop the carbohydrates out, you're basically, left with protein and fat. And one of the biggest misconceptions with a ketogenic diet for women is that it's high fat. For some patients that have some body fat to lose, which will help improve their sleep, actually increasing their protein above kind of what would be considered a standard ketogenic diet can help with satiety, and it can help with weight loss. So that's one thing, is that if you're trying a ketogenic approach, you actually may want to try a little bit higher protein and a little bit more moderate fat consumption than what is the standard ketogenic diet. The standard ketogenic diet was made for children with epilepsy who many times were underweight. And so having all that extra fat not only kept them making high levels of ketones, but also helped them keep their weight up too. So that's one thing that women really should know, is that sometimes a higher protein and more moderate ketogenic diet is sometimes more appropriate. But the biggest time that I encounter women in my clinic having major issues with sleep and diet can play a role is perimenopause and menopause. So as women make this transition into menopause and the ovaries are no longer secreting large amounts of estrogen and progesterone, we start to see some major sleep disturbances. And some of that has to do with the lack of progesterone, because one of the metabolites of progesterone works as a neurosteroid in the brain, and it can be somewhat sedating. It can make you a little bit sleepy. So as they lose that progesterone, they start to have a lot more sleep disturbances. And then what also is happening is they're starting to lose their insulin sensitivity. So the blood sugars are now bouncing, all around. So making good dietary choices through this transition can help mitigate some of the symptoms of perimenopause and menopause that we see. Now, some women need hormone replacement therapy, and I, prefer bioidentical, and that can help with some of the sleep disturbances. But we always work on these other things first, and that definitely includes nutrition.
And what about for women going post-menopause? That is there anything that they need to be mindful of for their sleep? Because of course, then so many women deal with this experience of less melatonin as they get older, and then it can be some really frustrating experiences for women as they're post 60s, and the trouble with their sleep there. Do you see any clear call outs for them?
Yeah, unfortunately, as we age, we don't do a lot of things very well.
Well said.
It's not anybody's fault, but as we age, our bodies get less efficient at, utilizing things like protein. And we definitely see this rise in like I said, lack of insulin sensitivity that happens.
Yes.
And so some of these things are not necessarily our fault. They're just the normal aging process. We also see a huge turnover in the gut microbiome, which also can have an effect on sleep, because that affects like our hormones and biochemicals that either stimulate or sedate us. So it's an unfortunate truth. That's what I tell women that finally transition into menopause, that you cannot go back and you cannot be 20 or 30 again. And we just have to control the controllables. And we know that as people age, they need less sleep and they tend to sleep less. But I really think that by controlling nutrition and sleep hygiene, exercising appropriately and de-stressing appropriately, that we can still get good quality and quantity of sleep even as we age.
And so what are some of the, just almost the low-hanging fruit things that you might put in for women or anyone, but we happen to be focusing on women in this conversation, that you see that can make a profound difference? So as in some of the go-tos being things like coffee and alcohol. Right? Are there some of those things that you've noticed?
That's a big one.
Okay, great.
Yeah, that's a big one. When people have sleep disturbances, we look at their diet, and then alcohol and stimulants. Alcohol tends to, although it may make people sleepy and fall asleep, what we know from the data is that people don't get good quality sleep. And alcohol actually is pretty good at dropping blood sugars, because we see a small insulin effect. And that's been something interesting too on the CGMs, back to the CGM data.
Yeah.
Is that if I were to drink a glass of wine, my blood sugar starts to drop because it's spiking insulin just slightly, but you're not consuming glucose with it in enough amounts. And so that can cause blood sugar dysregulation too. So alcohol's a big one for women, cutting out alcohol, especially if they're having it, like at dinner time or in the evenings. Avoiding the use of any caffeine or stimulants, especially after like lunchtime or noon, is what I use. Another big one in this day and age is blue light exposure. Yeah. So, we used to live outside under the stars and the moon, and our circadian rhythm was set by this exposure or lack of exposure to that sunlight. And now we live in houses and offices and cars and all these different places. And I live in Nebraska, which means in the dead of winter, it's possible that I'm really not getting much sunlight exposure at all.
Sure.
And then we have these smartphones and computers that we sit in front of all day. So I really look at people's technology use, especially in the evening before they go to bed. I'm a huge fan of like blue light blocking glasses in the evenings. Yes. And just ambient light and things like that. And then I also look at their bedroom environment. We have these new mattresses now. Just the materials we're starting to make mattresses with can sometimes not breathe as well, and it can overheat women. And sometimes what I found women describing as maybe night sweats actually is like a new mattress they bought that is actually overheating them in the nighttime. And so I always talk about like light, cool bedding. I find that these memory foam mattresses actually are very heating. They really heat people up.
Yes. Yes.
So we really have to look at what the sleep environment looks like. And then people who have TVs in their bedroom, there's that blue light exposure again, or they have their smartphone next to their bed and it might be dinging or lighting up or, these types of things. So we really have to look at our environment, and you really have to make almost like a routine before you go to bed. But the big thing I tell people who have problems with insomnia is that you have to teach yourself how to fall asleep and get restful sleep. And you can't just expect it to happen. You can't force it to happen. Sleeping medications don't work. They're like a hammer over the head.
Yes.
There are some natural remedies that I will allow patients to try, like melatonin, valerian, 5-HTP, L-theanine, skullcap, chamomile. There are some things that can help, but we have to fix all the other things, first. I kind of just, use those to fill the gaps, quote unquote. But we have to look at all these different things. But for patients that have trouble falling asleep, I equate it like you wouldn't sit at the dinner table if you weren't hungry, right? You'd get up and walk away. So sometimes I tell patients, if you lie in your bed and you cannot fall asleep, go out into the living room, sit on the couch, pick up a book, do not pick up anything with blue light, and wait till you feel sleepy and then go lay back down. Because sometimes for people that have issues falling asleep, or the people that wake up at 3 a.m. and cannot fall back to sleep, it can start to cause a lot of like racing thoughts. They're trying to force themselves back into sleep, and it can just cause more distress. So these are all kind of the different things we look at. And from a hormonal perspective, back to the people that have these nighttime awakenings, a great thing I do is we'll do 24-hour cortisol testing, and I'll actually have patients, if they wake up at 3 a.m., actually spit into a tube of saliva.
Yes.
And we look at what's happening with their cortisol in the middle of the night if they're having these awakenings, to see if it could be, some sort of adrenal or HPA axis issue.
That's so great. And so do you suggest for women that are, suspect that their cortisol levels might be a bit imbalanced, do you suggest that they work with their OB-GYN, or how should they go about the inquiry around the testing of that?
Great question. So the test that I love using, I use a Dutch test that looks at all the hormones and it looks at cortisol. Not all OB-GYNs are necessarily familiar with this type of testing. So a functional medicine provider or integrative medicine provider might be a little bit more versed, just because my background is a little bit different than my colleagues. But finding a provider that offers this type of testing, I think it's great data to look at, what your 24-hour patterns look like. Is this something that would be helpful working on, or does it look normal? And then we go down, another road.
So interesting. Okay. So I have so many question marks as I'm speaking with you, but to be mindful of time, I was wondering if you could just share with us, just even on your own personal note, like what have been some of the just most interesting or most kind of transformational changes that have come out for you, of particularly with the glucose monitoring? Like what are just some things that you used to do that now what you would never do, or that you see makes like really no change, that have surprised you? Like what have been the most interesting findings for you so far?
It's interesting, like looking at different carbohydrate sources and what I eat them with, and what they do with blood sugars. You had brought up something like apple cider vinegar. Like for instance, if you take a shot of that before you eat a meal with carbohydrates, I would see like a blunted response on my glycemic variability. So, the people that love like this biohacking, there are some interesting tactics that you can kind of learn. I noticed that I definitely can never have what I call like naked carbs. So if you have carbs by yourself, huge glycemic variability. One time I took my mom on vacation and I tested like a margarita, and like I said, alcohol has a lowering effect. No. My blood sugar shot up to like almost like 170 or something with that.
Wow.
And it came crashing down. I felt horrible.
Believe it, yeah.
So there's just been some really opening things. And what's interesting is as I start to share my data with other women, women will message me and say, I was going to go to this party and have a piece of cake, and I remembered what your blood sugar looked like when you posted that, and I chose not to. It's just such an amazing visual, what's happening. And then on the days where I eat really well and my blood sugar looks so stable, what the biggest takeaway I've noticed since really fixing my diet is the way that my mind works. It just seems to be like firing on all cylinders. My energy feels good. I don't feel like I need caffeine and stimulants and things like that. I just feel this like intense mental clarity. I sometimes when I do speaking events, I'll say it's almost like I can smell colors. That's what it feels. It just feels like a whole nother like level of like mindfulness. And amazing. And that's probably been the biggest change or surprising change, really with fixing my diet.
Oh yeah. You've got like an added layer of senses now. It sounds like superhuman. Wow. That's really, really cool. Okay. Oh, and I guess I'll squeeze in one last question. If we're, is there any other, so you mentioned, with, apple cider vinegar kind of helping, certainly not doing the naked carbs. I love that terminology. That's so clever. Anything like the activated charcoal or all those sort of things, or do you find that doesn't affect things for you?
I've never tested charcoal.
Okay.
There is another herbal supplement called berberine, which I'm a huge fan of because it, in head-to-head studies with a prescription drug called metformin, actually does just as good a job at controlling hyperglycemia pretty well. And I've noticed that can help blunt, meal responses too, taking like 500 milligrams of berberine with your meals. So if you're having some issues with your glucose, that could be another kind of little hack to try. Is to try adding 500 milligrams of berberine, with each meal. And that can help the blood sugar issues too.
Wow. So good. Oh my goodness. Okay. I will cease my questions because I know I could keep going for hours with you. So thank you just so much. And what I know you've piqued the interest of so many people. So what is the best way for people to follow all that you're up to? You're clearly, in this game of testing and sharing and creating a whole community. What are some of the best ways for people to stay in touch with you?
Yeah, people can find me on Facebook and Instagram, Dr. Fit and Fabulous. I've got a website, drfitandfabulous.com, where I try to keep up to date on podcasts I've been on or speaking engagements and things like that. I've got a new YouTube channel that's starting.
Yay!
So you can find me all over the place. And I love connecting with people. I love hearing people's stories. And if anybody's interested in being my patient, I'm not quite set up for telemedicine. You have to come to Omaha to see me, but I've gotten a lot of people in my clinic wanting to work with me, and that's a common question I get. So,
okay, well, maybe to be continued on that part, because I'm sure people across the nation and globe would want to work with you. So, we'll hold out for that. In the meantime, we'll also be sure to follow you, and I certainly have gotten a lot out of following you on Instagram. So. Really great content. And thank you again so much for taking the time to speak with the Sleep is a Skill community.
I appreciate the opportunity. Thank you.
You've been listening to the Sleep is a Skill podcast, the #1 podcast for people who want to take their sleep skills to the next level. Every Monday, I send out something that I call Molly's Monday Obsessions, containing everything that I'm obsessing over in the world of sleep. Head on over to sleepisaskill.com to sign up.